You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you for joining me on this week's episode of Simple Health Radio. I'm your host, Dr. Emron. On today's episode, we will be discussing an insect infestation, which is affecting a large part of the United States. The patient that I had was about 2 years old. She was a healthy young female. We'll call her Jeanette. Jeanette was playing in her backyard. She was walking through the grass when she suddenly started screaming and crying. Her parents came over and examined her, and they saw that her left foot was very red. She kept pointing at the foot and scratching at it. When the parents looked a little closer, they realized there were small insects all over her foot, biting and stinging her. The family tried to squish them and remove as much as they could, but they were unsuccessful. They brought her inside, took her to the bathtub, and tried to wash off the remaining insects. The patient was brought in to me the next day in the emergency department because her entire foot and lower part of the leg became red and swollen. She had blisters covering most of those areas. It was very painful. They had tried Motrin and Tylenol without any improvement. When I examined her, I already knew what the insect was, but the parents had no idea. The patient was actually exposed to red fire ants. Red fire ants are a very big problem in the United States. Currently, there are 14 states that are endemic and infected with this particular insect. Red fire ants are the ones that seem to be causing most of the symptoms. Basically, these are very aggressive insects that live in hives or nests or hills, and they tend to live in populated areas, for example, near homes, playgrounds, schools, and parking lots. In this situation, the 2-year-old was playing in her own backyard. The family didn't even realize that there was an anthill developing. The red ants are not native to North America. These were actually imported by mistake through multiple cargo ships and shipping channels over many, many years. Many of these actually came from Africa, and they are very aggressive. The family did not typically spray the backyard, and they were not concerned about red ants, and truthfully, they developed overnight, which is often the case. Sometimes they'll peak in the summer months, and other times they'll develop after a rainstorm or after new development when some of the earth has shifted. Now, the presentation where this patient suddenly began screaming and crying is very common. The fire ant actually causes a sting. It's a bite that has venom inside of it, and it causes a chemical reaction, which leads to swelling, redness, burning, and blister formation. In this particular case, because this was a 2-year-old, her immune system was very sensitive, and her skin was also very sensitive. So her entire foot became swollen and infected. By the time she had seen me the following day, there was already a bacterial infection called cellulitis. The fire ants themselves actually have proteins that are injected in the venom, and that causes a very special type of chemical reaction which turns into hives and wheals. Not everyone will develop it, but the younger children seem to be more sensitive than older adults. After a couple of days, there will be a pustule or vesicle. This is a bubble that fills up with clear fluid, and it becomes very, very itchy and swollen. After several days, that area will open up, and that's usually when the infection can become worse. There are situations where people can be stung or bitten hundreds of times. For example, if they step on an anthill and they are intoxicated, or perhaps they have dementia or autism, and they don't have enough neurologic function in order to get away quickly enough, this could actually lead to a severe allergic reaction. There have been life-threatening situations where people develop wheezing, they develop hives, and they may not make it to the emergency department in time. Some people have actually died from these reactions. The massive attacks are becoming more and more common. They are also affecting animals. And in Texas, the rate of fire ants is increasing. There are actually animals that are in the wild or on farmlands that have been killed by these aggressive fire ants. The trend is that the ants are multiplying at a rapid rate. Currently, 14 states have the problem, but it's expected that this will increase because there's a lot of cross-contamination, and there are still packages and other cargo that are being shipped in from all over the world that may have these ants on them as well. There's no special skin test that is used to diagnose whether someone is allergic, but there are some other testing that can be performed if necessary. People who are highly allergic to fire ants are recommended to carry an EpiPen and to be very vigilant. They should simply avoid any areas that may have fire ants on them Otherwise, it can lead to a hospitalization. There are situations where antibiotics and steroids are necessary, as in the case of this 2-year-old child. I did prescribe her the medication, and she rapidly improved after several days. She had no long-term side effects. I always advise people who have any type of fire ant bites to try some simple things. They need to soak the foot in Epsom salt. They can actually apply meat tenderizer, unseasoned meat tenderizer, directly to the areas that are bitten. That's actually known to break down the protein chemicals that cause the itching and the redness. They can use Benadryl to help with some of the discomfort. And if none of those things are working, they need to be in the emergency department. This is especially true in people who have a known history of allergic reactions to other insect bites and anyone who may have other health problems. I hope that you've learned some information about fire ants today. If you have information to share with us or other ideas on how to avoid that, please reach out to us on our Twitter page. We have a lot of active people who provide insight and also advice on what to do for this and other conditions. You can listen to the episode on iTunes and Spreaker. We're also listed on iHeartRadio and Spotify. I look forward to having you on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.